Good evening, my dear students, OET aspirants. I welcome you all on behalf of B-GHUD family on this virtual platform. Today is our 43rd live session class we are conducting with. It's me, Abhilash Vijaymohan Nair, again on this virtual platform for this amazing role play presentation, my dear students. All of my dear students, once again, welcome you. So we are getting very good feedbacks from all our students that they are making useful they're making these sessions useful. So thank you for giving us and supporting us with this feedback, my dear students. So once again, welcome you all. So we don't have to waste much time. So this question was sent to me by Arjit. So Arjit wants to discuss this question. So thank you, Arjit, for supporting us, and thank you all, my dear students, for consistently supporting us with your comments, your suggestions, and your directions. So always, I welcome your appraisals. We welcome your suggestions for our more improvement and upliftment. We could improvise the quality of our class. So if you people used to support us like this, okay. So once again, all the best. By next year, this time, all those who are watching and learning, may God Almighty shower His blessings upon you all to fly into weathering heads with multicolors. May all be there in your dream destinations by next year, this time. So let us go to this class. Setting is okay. The question will be displayed right now. The question here comes the question. So that will be displayed now and we'll be going for the discussion. So make use of this role play. So can never go for by hearting or mugging up the things. Instead, you need to practice. Take the dialogues, practice, and speak out in your own words so that it will give the more natural tone. Intonation can be improved like that. Yes, here comes the question. Yes, the setting is a hospital ward. Checking on a 48-year-old patient who has developed osteomyelitis. There is a bone infection in his or her leg. Okay, explain your role. That is, we are here to monitor take vital signs, check intravenous drip, etc. Find out how the patient is feeling. So the question is a known case, admitted case with osteomyelitis infection. That means a bone infection in leg. Okay, it is the leg area. The patient is having the infection. Explain your role. So why we are here to monitor wound, vital signs, and IV drip? We need to inquire their well-being, general well-being. Describe the symptoms of osteomyelitis. So the patient would be verbalizing something. So we have to talk in behalf of symptoms like fever, pain. Okay, reassure the patient about progress. So some sort of progress has been noticed. Reduction in fever. It is supposed of antibiotics. We have to explain it to the patient in a sort of reassurance. Okay, find out more details about pain. So we need to collect more details like change in level, change of location, any pain, all these things we need to inquire with the patient. Okay, give reasons for exploring changes in pain. So when we start asking repeatedly regarding this pain, the patient would question, why nurse, why are you very curious or inquisitive in asking about pain? Why are you exploring this pain more frequently? So if they ask like that, we have to explain importance of monitoring because possible signs of secondary infection. Through assessing pain only, we could able to rule out the risk for secondary infections. Okay, advise the patient to communicate any changes in pain. So we have to strongly request them to convey any changes in pain. Okay, find out if the patient has any other concerns. As for that, yes, explain treatment stages before discharge. So when the patient asks you about discharge, we need to explain the treatment stages like controlling of infection is very much necessary. Switch to oral antibiotics. IV will be shifted to oral antibiotics, and finally, so that they can establish a self-medication routine. When the patient is able to take medications by itself, when they can organize or operate medications by self. That is a time when they will be considering the discharge. Okay, next, describe antibiotic treatment plan. So regarding the antibiotic treatment plan, you should explain like several more days IV in hospital. So IV infusion will be continued for a few more days in hospital. So now they are not going to go for discharge, because IV infusion will be continued for some more days. 4 to 6 weeks tablet at home. Even after discharge, 4 to 6 weeks complete course is done in this done at home. It should be done at home. Establish the patient willingness for you to do the necessary checks. So after making the patient convinced and calm and composed regarding all their condition, once the patient convinces about all his inquiries and concerns, we have to take the consent. We have to fix the consent for carrying out our necessary checks, because we are here to monitor vital signs, wound, and IV drip. That's all. Okay. So I think the question to all my dear students, anyone is having any sort of doubt, means you could pin your suggestions over the comment box. You could throw the questions. You could throw your queries and concerns if you have anxious. Okay, so I'll be very um, extremely, I'll be delighted to clarify your concerns. So please make sure that you're throwing your concerns, your suggestions, your doubts into the comment box, my dear students. Okay, those who are watching. Yes. Yes, so now it's not, there is no time to waste. No one is throwing me any question. I think the question is clear to all my dear students. Let's start. I told you this is a known case. So we know the patient very well. Admitted case of osteomyelitis, IV infusion is going on. Okay, so we are going to take this topic as a known case and it's going to carry on the conversation. So in midst question will be displayed. Now we are going to start the dialogue. Good morning. Good morning, Mr. Martin. Okay. Universal name for mine is like Martin. So I'm comfortable with that. That is why. Okay, if you want me, you can change the name. Okay. So your dialogues. Good morning, Mr. Martin. I'm your nurse here today. I'll be working with you. Okay, I'll be the nurse working with you today. Good morning, Martin. I'll be the nurse working with you today. It's time for me to assess your wound, vital signs, and IV drip. It's time for me to assess your vital signs, wound, and IV drip. If you're okay, uh, shall I move ahead? Okay. Shall I move ahead? If you're okay, can I do that? Alani? Shall I move ahead? Okay. Well, before that, tell me how you're feeling. Is everything going on well? Well, before that, please tell me how you're feeling. Is everything going on? Okay. So this is the way by which we can go for an introduction. Good morning. Good morning, Martin. I will be the nurse working with you today. Yes. How are you feeling? Okay. It's time for me to monitor your vital signs, wound, and I will. If you're okay, shall I move? Okay, so before that, tell me how you're feeling. Is everything going on well? Is everything going on well? So the speed is like that is the normal pose, moderate pose, pace, moderate pace you can take. Like okay, uh, hope you're comfortable. So shall I move ahead? Okay. Is everything going on well? So they'll be saying like, yes, nurse, I'm okay, I'm feeling okay, but fever has come down a bit, but still the pain is there. The patient would be verbalizing their complaints. I see. Okay. I see. Or you can say like, I see. Martin, um, you don't have to worry. I see. Martin, you don't have to worry. See, fever and pain are usual manifestations of osteomyelitis. Fever and pain are usual manifestations of uh, osteomyelitis. And see, there is, and don't have, you don't, no need to be anxious or no worries. There is positive impact of antibiotics over your health. See, the fever has come down. Okay, it is not that as usual. Now the fever has come down, so it is a positive effect of antibiotic. Eventually, the pain will also decrease. Eventually, the pain will also decrease. It will take some time. Okay, day by day, you will become little better. It will take some time. Day by day, you will become little better. Okay, so this is how. So the patient would be verbalizing fever and pain. Yes. Okay, you can say like yes. Fever and pain are usual manifestations of osteomyelitis. You don't have to worry. See, now there is a reduction in fever. It is the positive impact. It is a positive outcome of antibiotic therapy. Eventually, the pain will also come down. It will take time. Okay, day by day, you will get a little better. Okay, relax, be confident. Okay, you will be all right. Okay. Well, you have told me that there is pain. Shall I ask you a few more questions on pain? I need to detail. You need to detail me regarding your pain. Shall I ask you a few questions? So they'll be saying like, oh yes, nurse, please continue. Tell me, how's the pain? What is the how's the pain? How severe is the pain? What is the level of pain? Is it mild, moderate, or extreme? Is it mild, moderate, or severe? Okay. Okay. Or if you want means you can make yourself a pain scale. Now I'm not using that. Okay. Tell me how is the pain? How you feel pain? Is it mild, moderate, or severe? Okay. Be answering to that question. Um, is there any change in location? Okay. Do you feel pain at the same location, or is there any change that you have noticed when it comes to pain? Still there on your lower extremities? Okay. Okay. Do you notice any new spots where there is pain? Okay. Do you notice any new sites, or do you notice any new spots where there is pain? So the patient would be answering to all these questions and will be asking you, why, nurse? Why are you asking me more on this pain? I understand why you're feeling like this. See, as I mentioned, pain is the classic manifestation of osteomyelitis. I understand why you feel like this. It is usual. See, as I mentioned, as I mentioned, no need of using C. Okay, I know why you're feeling this way. Uh, uh, I know why you're feeling this way. As I mentioned, pain is the classic manifestation of this. Okay, we would be able to find out the risk for secondary infection if pain is assessed, if only if pain is assessed properly, we'll be able to find out the risk for secondary infection. We'll be able to find out the risk for secondary infection only if pain is assessed properly. Okay, it is imperative to monitor pain. Okay, it is imperative. It is imperative to monitor pain. So I strongly request you to convey any changes, whether it is mild or moderate or severe, whether it is mild or moderate. I strongly request you to convey any change in your pain. That's a must. Okay. So we would be able to act accordingly if you convey it properly. If you would be able to act accordingly if you convey it properly. I hope you're getting me. I feel you are understanding the seriousness of the situation. Okay. So please do that, Martin. Okay. So they will be saying like, yes, no. So I will definitely do that. Thank you. Great. Okay. Well, so you have just told me regarding your fever pain. Is there any other thing that is bothering you? Do you have any other concerns? Okay. Do you have any other concerns? Is there anything else that you would like to ask or discuss? The be asking like, what about my discharge nurse when I can go home? Well, I understand. Well, I value your feels. Well, I value your feels regarding discharge. Uh, I'm sorry, I wouldn't be able to comment on your discharge. I won't be able to comment on your discharge. It is subjected to the doctor. Okay, they will assess your progress. Once the infection gets controlled, they will assess your progress. And once the infection is controlled, the decision for discharge will be taken. Okay, the decision for discharge will be taken. Okay, and before that, it is very necessary to once the infection concerned, it is very necessary to convert the infusions into oral antibiotics. Okay, so now you are on IV infusion. Now you are on IV infusion. Before discharge, IV antibiotics will be switched to oral antibiotics. IV medications will be switched to oral medications, or IV antibiotics will be switched to oral antibiotics. Okay, so that you can continue the medication at home, so that you can continue the medication at home, so that you can continue medication at home, and you can establish a self-medication routine, and you can establish a self-medication routine. So these are the necessary criteria, okay, before discharge. These are the necessary criteria to consider discharge. So these are the necessary, these are the essential to consider, these are the essential to consider your discharge. So once the infection gets controlled and IV medication gets switched to oral antibiotics, and once you establish a self-medication routine, so then the doctor adds to your discharge. Okay, so now it is very important to focus on treatment. Hospitalization is a must. IV infusions has to be continued. So they will be asking like, nurse, how long do I have to continue with this? IV infusions will be asking you. Yes, I know you're very curious about your treatment. See, at hospital, here in hospital, we will be continuing IV infusions for some more days. I know you're very curious regarding your treatment. In hospital, IV infusions will be done for a few more days. IV infusions will be carried out for a few more days. After that, as I told, it will be switched to oral antibiotics before discharge. Even after going home, a course of 4 to 6 weeks antibiotics is very necessary for your complete recovery. And after your discharge, after going home, A course of 4 to 6 weeks antibiotics is very much necessary for your complete recovery. So this is how the um, course of treatment happens. Okay, this is how the treatment is done. This is how the course of treatment is done. So it is most importantly, you don't. I want you to focus on your medication. Never the dose. Follow the medications as prescribed. It is very, very important in your recovery. Okay, I hope you're getting me. Yes, I hope you're getting me. And see, with proper treatment management, with proper treatment management care and adherence to instructions, I'm sure you will be back on track. I'm sure you will be back on track. Okay, it takes some time, but I assure you complete recovery. It takes some time, but I assure you complete recovery. I hope you're confident now. Are you? I feel like you're more informed. Hope you're. I feel like you're more informed. Hope you're confident now. Any other questions for me? Do you wish to ask anything more? Or is there anything else bothering you? I hope your concerns are clarified. Uh, if you have got any questions, feel free to ask. I'm here to help. You're saying like, no, no, thank you. Thank you so much. Okay. If you're okay, then shall I proceed with, if you're okay, then shall I proceed with then daily checks? Delivery of speaking and practice it. Okay, with proper practice. It will be what student speaking. Okay, and you can get to even you can fetch any band. So my intention when it comes to my students is to fetch, is to make them fetch any band. Okay, please do that, my dear students, all of you. So see you for our 44th speaking session by next Friday. Till then, take care, practice well. God bless you. See you all.